Hey, welcome back to my channel. Today we will talk about very high yield disease associations with skin conditions. I won't be describing the skin conditions themselves. I'll just mention the skin conditions and their systemic associations. Okay, these are extremely high yield for USMLE as well as self exams. Recognizing these associations can give you important clues, and that will help you connect the dots and narrow down the diagnosis on your test day, helping you score points efficiently. So without further delay, let's begin. Okay, now starting with the skin conditions, first I'd like to talk about Lichen Planus, Porphyria cutanea tarda, and cutaneous leukocytoclastic vasculitis secondary to cryoglobulinemia. Okay, if these skin conditions are seen, then we need to think about one condition, and that is hepatitis C. Okay, so these are associated with hepatitis C. If there is Dermatitis Herpetiformis, then that is celiac disease. Okay, if it is PAN, polyarthritis nodosa, then we need to think about hepatitis B. Okay, so if there is Erythema nodosum, okay, maximum of us we know about sarcoidosis and TB. Okay, but we also should know about this is very high yield, that is coccidioidomycosis. Okay, so think about this. Also it is associated with inflammatory bowel diseases. Okay, now talking about pyoderma gangrenosum. Okay, it is also associated with inflammatory bowel disease. Okay, talking about acanthosis nigricans, we maximum of us know about insulin resistance, but few might not know that it is also associated with GI malignancy. Okay, not just PCOS and insulin resistance, it is associated with GI malignancy, and this is very important. Okay, and there is something that is like if there is sudden onset of severe psoriasis, if the person is presented with sudden onset of severe psoriasis or the person has recurrent herpes zoster infection, or the patient has disseminated molluscum contagiosum, what we need to think is we need to think about HIV. Okay, we need to think of serology testing. Okay, in these cases these are associated with HIV infection, so these are very high yield. Okay, if there is suppose like multiple EG seborrheic keratosis, okay, in that also what we what we have to think is GI malignancy. Okay, this is also very high yield. Okay, now dermatomyositis is also associated with malignancy. Okay, in this case maximum it is associated with ovarian malignancy, but we can also see this malignancy of pancreatic as well as lung carcinoma, and in some cases it is also associated with interstitial lung disease, but the high yield point is dermatomyositis is associated with ovary. Okay, ovarian carcinoma. Okay, now let's talk about multiple skin tags. Okay, in multiple skin tags we know one is insulin resistance. This is like almost we all know about it. Okay, but what if this multiple skin tags are present in perianal area? Okay, then that is associated with this is Crohn's disease. Okay, so this is very high yield. Okay, these are associated with Crohn's disease. Okay, now let's talk about necrobiasis lipoidica. Okay, it is actually associated with diabetes mellitus. Okay, talking about Kaposi sarcoma, again it is associated with HIV. Okay, we need to think about HIV if we see Kaposi sarcoma. Okay, if there is like suppose pruritus but without rash, okay, in that this is highly suspicious for cholestasis. Okay, biliary obstruction. Okay, we need to think about that. Okay, and talking about suppose livedo reticularis. Okay, in that we need to think about polyarthritis nodosa. Okay, again we can link this PAN as hepatitis B, right? PAN is associated with hepatitis B. Okay, and then spider angioma, it is associated with chronic liver disease, cirrhosis. Okay, If there is telangiectatic macules on mucosa, we need to think of hereditary hemorrhagic telangiectasia. Okay, so these are very high yield, but if we know, we can easily this if these clues are, if you know, if you can identify these clues, again there can be lab findings. Okay, there can be systemic clue, and if we have that ability to link it to a skin condition, then we can immediately narrow down the differential, and you can narrow down the diagnosis, and that will definitely help you to on easy point on your test day. Okay, so these are very high yield associations, and these are very important. Okay, so these maximum of them are very important. Okay, so I think I'm done. There are still very, like, suppose if there is severe seborrheic dermatitis. Okay, I have not mentioned that. Okay, if there is, suppose, severe seborrheic dermatitis, okay, then that is also associated with HIV infection. And the other one is, you might find it little weird, but that is Parkinson's. Okay, in Parkinson's disease, it is also very important. Okay, and then did I mention about pyoderma gangrenosum? Yeah, it is for this inflammatory bowel diseases. Okay, I think I'm mostly done. Okay, if there is like this umbilical nodules, then that is associated with gastric cancer, pancreatic cancer, ovarian cancer. Okay, then okay, there is one thing that you always need to remember. Suppose there is vitiligo or any autoimmune disease, that is always associated with other autoimmune diseases. Okay, that is also very high yield. If there is any autoimmune diseases, we need to think of other autoimmune disease association. Okay, so I think I'm done. If there are other, I'll make such useful videos. If you find this video useful, helpful, please do subscribe, and please do comment if you want me to upload any videos on topics you want. Please do comment. I'll try to upload them. Thank you so much. Stay blessed and keep studying one step closer to your maths day. Take care. Bye bye.